Welcome. It's good to be here.
Thank you.
We're here at Charlotte's Inclusive Tech Innovation Pilot, and this is a version of Hop on the Mic, is what we've been framing it. And it's a way for us to share what we're doing in the community, how we're doing it, and with whom we're doing it with. And so knowing that Charlotte's Inclusive Tech Innovation Pilot was funded by NTIA for connecting minority communities, we want to make sure that we're chronicling the story as it's happening. And so we have an opportunity to be here now with Ms. Lavitris Rayleigh at the Kids Garden Redesign Learning Center. Good to be here.
Thank you. It's good to have you guys here.
So we were here a little while ago, maybe
know.
a month and a half ago.
Yes.
And this place was completely different.
Yes.
You were in the middle of redesigning, not just in the name, but the space itself.
Exactly.
And so we had a chance to walk through, see some things, and just learn about what's happening. So that's what I know so far. But I want to pass it to you for you to tell us exactly what is this space, what is this learning center, and what's your vision behind it?
So the space is a very special space for educational approach due to the fact that it's a small home school type of facility dealing with children that need small spaces. We are a preschool, homeschool, and a community-based school that the public can come in and learn technology through the innovative software that we have. A lot of parents, they struggle working with their kids because they don't know technology. So with me being a certified community health worker, I want to be able to pour into the community with helping to spread technology. And I was very happy to be part of the technology program with Johnson C. Smith to help bring in iPads and tablets to help with that innovation.
So tell us a little bit about who you are. Community service, the service for young people, service for families, service for children. Tell us a little bit about your background.
So I was a licensed child care provider for 18 years with the state. I loved it, but after COVID, I shut down, and I was able to explore child care in a more comfortable way because I'm only doing it like 4 hours or less a day. 2 sessions, which gives it more spaces to be available to the community and for parents to be able to have more of an option. Being licensed is great because you learn a lot about what it really takes to protect a child in an environment such as what I'm doing. Just the part of bringing it all together. It was just something that I thought had left me, but it didn't because I kept thinking about the kids. And being able to teach the way that I want to be able to teach in a redesigned way with technology, Montessori base, that's what was very exciting about what I'm doing.
So you're using technology and artificial intelligence, augmented reality. How do you bring that to young people, to children, so that they can understand it?
Well, if you notice, most kids, when you see them, they have a device in their hand, probably a cell phone or a tablet. Today, kids their minds are just more targeted towards technology. And as we move forward, that's the way it's gonna be. It's gonna incorporating technology into what I'm doing is going to be exciting because it's the repetitions of what kids see, what they touch, how technology work with their minds. And it starts when they're born. I've seen kids 1 year old. Now the limitation of them being on tablets is a concern, but when you're teaching technology as far as through numbers, new beginnings, learning, concepts of what kids start with, from numbers to math to science to, it's all designed now in a technology way for kids to be able to just grasp it much easier than us just physically showing them. But when they can do both, that's what really enhanced their learning.
Well, we met earlier you had shared an interest in helping parents and the community, not just children. Tell us a little bit more about how that works.
Well, a lot of kids today, like they're even when they're in school, they're using Chromebooks. When they go home or when they leave a situation, parents don't even know how to even help their kids or in a way to be able to maneuver with things. I've noticed that like a lot of parents, even from, just dealing with parents coming in, my whole system is technology, from signing in to enrollment forms to communication. And in order for them to even be part of this program, they have to know how to use technology, which is software. So what I want to do, I want to be able to open up my facility to parents, not just the parents who children that come here, but to the community, that people can come here and just basically get basic technology literacy, learning just how to move around the tablets, even their phones. People have phones and they don't even know how to do nothing but dial. So we'll have like classes where people can come in and just learn in open facility. Like if a child even need help with their homework, they can come, they can sign up to be able to come and get help with their kids with their homeworks here.
Tell us about the community where you're located.
So I am located right in a slight financially challenged community, which is the borderline of the kind of like east side of Charlotte, that is sitting right at the beginning of Sharon Amity, where financially challenges still exist in this area. Just being in the community that I came from is where Johnson C. Smith is located at, which is the West End. I came from that community, very, very financially challenged coming up. And it was just my goal to be able to see kids be able to get the things that they need to get to succeed.
If people were to leave and only remember one thing about what we talked about today, what would you want them to remember?
That I have a facility that is like a home, that they can come and receive comfort, and when they leave, they can take a deep breath.
Is there anything I haven't asked that you want to share?
No. No.
I'm gonna take a moment of privilege. So, we met because of someone who's very special to both of us, Miss Shirley Mann.
Oh wow! Now Cheryl, I should definitely have something to say about Cheryl.
So tell me something about how she connects people, how she connects community, how she helped us to get together, and just a vision that she has for community and the people that do work in the community.
Well, I've known Cheryl for a while, and Cheryl have known me. I started out being Cheryl, licensed hairstylist, which that's what I am, a licensed hairstylist, which I've said in the salon and been the counselor of the hairstylist. And Cheryl introduced to me community health. I knew I've been doing community health forever and didn't know it, because that's all my base was volunteering to do things that was just extraordinary. I actually have I actually have a Oscar nominee director that actually is doing a documentary about Miss V in the community with childcare, that came from the path of childcare. Cheryl has just been that backbone that kept pushing me to be able to become certified as a community health worker and to be able to live in my passion. Like, hair was my passion, kids was my passion, and then with Cheryl connecting me to become a community health worker, that's the one thing that really helped me to learn how to give in order to fulfill my passion with what I was doing. And the help that I actually just received from Cheryl, just being able to do what I'm doing, has just been tremendous. She is just, and she lives by the partnerships that she brings to you. She lives by that. One thing she told me, when Johnson C. Smith sent you that MOU, read it thoroughly. Understand it. Any questions, ask. So it's been great, and with Cheryl just being a part of helping me to just stay connected with what I'm doing, it's been wonderful.
So what's been the bridge from community health work to licensed child care centers for you?
So licensed child care centers is a whole different category because you're under a lot of different criteria as a licensed child care center. I'm not a licensed center. I am a facility that the state allows you to be able to operate 4 hours or less in a particular program that you want to design and do, and that's what I've done. I did licensed facility. Licensed facilities are great, and they have a lot of guidelines in those facilities to help you to stay safe and keep the kids safe. It protects you all around. With the knowledge of having 18 years of that, me being able to come into a facility and work 4 hours or less and bring technology. In a licensed child care facility, you can't have technology based on the way that technology is being introduced now. You're limited to the time, you're limited to the software, you're limited to a lot of things. In this particular situation, my limitations has to be constricted to software, constricted to learning, but in this environment, as far as the difference in it being licensed and unlicensed, it's the hours of care that you're giving. With my knowledge, I run it exactly as close as I can to a licensed facility to be able to be very well-rounded, because that's what a licensed facility is well-rounded. So just being able to, again, like I said, bring in the technology piece. Also, technology helps you with staffing, because AI teaches the kids so much. And whereas you're seeing a teacher stand there and teach your child, technology is doing it. And that's what we're moving towards.
So people are interested in finding out more about Kids Garden, Redesign Learning. How should they find you and connect?
So I have a website, which is kidsgarden123.com, and then also I am on Instagram with Kids Garden Charlotte, CLT.
Thank you so much.
You're welcome.